Welcome to The PA is In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. I'm Tracy Bingaman, and I'm obsessed with redefining what success as a PA looks like and what it feels like. Here you'll find the mindset shifts, systems, and processes I use to escape healthcare burnout and integrate my work into my life. Work-life balance is a myth, and an integrated life where you thrive professionally, not a balancing act, is the goal here. My mission is to help you to grow into a unicorn PA who loves their job, has abundant energy, time to spare, and work-optional financial freedom. The PA is in. Hey there, and welcome back to another episode of The PA is In. Today, we're going to answer some of those questions that you have that come up when a patient asks you a question about a fad diet, nutrition, GLP-1s, how to manage their obesity, how to be more active or get more fiber. All of your nutrition meets clinician questions are going to be answered by Colleen Sloan. Colleen is a registered dietitian and PA. She is the host of the Exam Room Nutrition podcast and a recent course creator who's coming to tell us all about how we can meet those patients where they are and be more compassionate, complete, and understanding in our treatment plans and conversations with them. Without further ado, here she is, Colleen Sloan. Colleen, welcome to the show. Thank you so much for being here.
Tracy, I'm so excited to be back on with you. It's nice to chat again.
So tell us, for people who didn't hear your first episode, who you are and what you do.
Sure. So I am Colleen Sloan. I am a registered dietitian turned PA. I've been a PA now for almost 10 years. And over the last 3 years, I have such a huge passion for helping clinicians learn about nutrition, talk about nutrition with their patients, and just combat misinformation that their patients are coming in with from social media or maybe that they're hearing on social media. So I created a podcast called Exam Room Nutrition. I've got an Instagram page and a LinkedIn page that creates some really helpful tips and tricks about talking about nutrition and weight with patients. And then just a few months ago, I launched a course helping clinicians guide their patients to weight loss. So it's called the Obesity Medicine Nutrition Course.
This is so needed because for as little as we learned about nutrition in school, and maybe you can talk a little bit about what those numbers are, there is so much information, misinformation, potentially dangerous information on the internet. Everyone and their sister is talking about nutrition and sort of what we need to be doing. It can be very confusing. So talk to me about what we can do in terms of approaching that and how much nutrition education do we actually get or are graduating PA students actually getting?
I'm really glad that you brought this up because you're so right. Nutrition is everywhere. And honestly, this year it's become quite political. We will not get into that. I actually don't even cover the politics of nutrition because it gets a little awkward and a little spicy and uncomfortable. But nowadays, you almost can't even say any fact that we used to believe as fact. For example, eat more fruit, right? Fruit is good for you, without being attacked by a number of people because there are so many different opinions and people with microphones and screens that are just sharing sometimes good information, oftentimes misinformation. So we are just flooded with nutrition information that it can be sometimes very challenging to sift through that and think like, wait a minute, these things that I've been taught for the last 10 years true, or is the science shifting? And we do need to stay current with the evidence, but we also cannot fall prey to any fallacies or any of that fear mongering that we see a lot. And I feel as though clinicians, it is our role to stay upfront and at the forefront of nutrition and policy and guidelines and everything like that, so we can guide our patients better. That being said, we both went to PA school. Every PA school is a little bit different. However, I remember maybe nutrition sprinkled throughout my program. It wasn't necessarily one dedicated course. Now, again, this might be different based on your program, but there was no specific nutrition course. It was sprinkled throughout, right? We're on the GI section and we'll talk about fiber when we get to constipation. Maybe we'll talk about the DASH diet and the cardiac diet if it's in the cardiology section, right? So it's there, it's sprinkled throughout. The National Academy of Sciences in 1985 actually set a standard for medical schools that they need to complete 25 hours in their medical school training of nutrition. However, and again, depending on the medical school, most are not meeting that minimum standard. Most are getting between 11 hours and 19 hours. And I want to take a step back and think about what that nutrition training actually is. It might be facts, it might be biochemistry, it might be kind of an eat this, not that. But when it comes to working with your patient and sitting in front of someone who is coming to you with concerns or who's struggled with their weight for so long, often you need to go beyond just telling them, well, the DASH diet can help lower your, blood pressure. You've got to help them actually apply that information into their life. And then that comes to play with behavior change, behavior modification, habits, stress levels, sleep levels. So it goes beyond nutrition information. And now we need to learn, how do we give nutrition counseling, which is very different from just learning the facts about nutrition. And I think that's where programs and schools are lacking significantly.
So if someone comes into your office and asks you a nutrition question, hey, I saw this on the internet, I heard this, my cousin lost, 1,000,000 pounds on the carnivore diet. Like, what do we do because I feel like this is one of those like whack-a-mole, like there's always, like it was called Atkins, now we're calling it carnivore, like it'll go back to low carb. Like, how do we keep up and like look up what are some good resources when people ask us stuff and we're like, quite frankly, I don't even know what that is?
Mm-hmm. Such a great question. And we all struggle with this. I mean, I'm sort of in the middle of this. I have the medical background, and then I'm also a dietitian. So I have both followers on Instagram, and I follow both people on social media platforms. And all of us struggle with when a patient comes in and they say, hey, well, I just heard so-and-so, or my neighbor's mailman, lost 67 pounds in 2 weeks on this diet. What do you think about that? And it's like, oof, you're just, like you said, like whack-a-mole, you're kind of just hit with this claim and wondering, okay. And like you said, like sometimes if I've never heard of it, I think the best answer is to say that and say, well, that's very, very interesting. I've actually not heard of that yet. If you have the time, which if you're in primary care, hello, we usually don't. But if you have the time, you can pull that up and, ask them, where did you hear it? So what's the source? Can be very helpful. And either Google that person or look on Instagram just briefly to see, like, what are their credentials? Is it someone that's just a health coach that did a 3-week course online, right? Is very different from someone who is a dietitian or has a PhD in nutrition science. That's those are two very, very different people with two very different backgrounds. Now, credentialing and, degrees isn't the end all be all. However, it's a good place to start, right? It proves that they have at least some form of education. They've dug deeper, especially someone with a PhD. They understand how to interpret literature and read research and outcomes and determine if this study is thorough or not. So it starts there, finding out, who did you hear it from? What is this source? And then it's totally fine to say, I have not heard of that yet. Because as a clinician, we're not experts on the quote Instagram diets. Like, it's almost impossible to stay current on all of that, in addition to trying to stay current on evidence-based medicine and the specialty that you practice in. And so I think just a blanket statement of like, I haven't heard of that. Like, let's look it up, or I'll get back to you. Or, and this will be my answer for a lot of your nutrition questions, refer them to a dietitian. Find a dietitian in your area, sit down with them, have a phone call with them, make sure that they're aligned with you and you are aligned with them, and have their number in your back pocket and say, here's a dietitian you can call. She probably knows a little bit better than I do about this topic. That's sort of the, easy answer for how I would address those frequent, hey, what about this? Hey, I saw this. Hey, what about this? And then I always bring it back to the basics, because it can get super overwhelming online, that there's always seems to be a new bad food that's like going to kill us or shred the lining of our stomach, or a new superfood that is like the mystery food we've been missing for 300 years. There always seems to be something new. And so I always say, bring it back to the basics. Like, the basics have worked for years, and that is focusing on fiber, which can come from fruits, vegetables, beans, whole grains, focusing on lean proteins, whether that's chicken, fish, you can do plant-based like tofu, edamame, tempeh. Pork is a lean protein, right? Variety in your diet, sleep and stress management. Those are not sexy, so those do not sell, but I always bring it back to reminding patients, are you doing these? Because if you're not, maybe don't waste your money on the $200 supplement miracle pill that your mailman lost, 67 pounds on.
Yeah. Yeah. And do you have a good resource for finding that dietitian? Is this like finding a hairdresser? Do we just like ask around who, how can we find a dietitian that's good, credentialed, aligned, that we think is going to take good care of our patients? Because this is sort of a conversation that starts in the exam room with us and then has to continue elsewhere, because we cannot be the dietitian and, the general surgery PA, or the dietitian and, the primary care provider.
Absolutely. And I actually put the onus of this on dietitians. So I made a LinkedIn post recently about this because, and I can say this in love because I am a dietitian, but dietitians often will say like clinicians don't refer to us, or we're not valued on the healthcare team. And I play devil's advocate because I'm a clinician, and I said, I'm in South Florida. I've never had a dietitian come to my office, introduce themselves, send me an email, say, hey, I work with, kids, or I work with this. I would love to partner with you. If you have any patients, here's my contact information. That's never happened. And I kind of say, shame on you, dietitians, for not networking and not letting your voice be heard. And so again, I put that onus on the dietitian to, if you are in a local area, go make the rounds, go to offices, send emails, network, maybe offer a workshop for their patients in the clinic, right? Do some free things, create handouts, make the clinicians' lives easier and make the referral easy. Because I don't think it should be on us to find a dietitian, just like any other specialty, right? If I'm referring to an ear, nose, and throat doctor, often they've given me a packet. I've got a folder of their specialty, of their information, of the insurances that they accept, right? So I know that they exist. So I think dietitians should do the same thing. Now, that being said, if you are proactive and you really, really want to find a dietitian, the Academy of Nutrition and Dietetics, which is our governing body, has a fantastic website. It's eatright.org/find-a-nutrition-expert. And it is super helpful. You can just put in your zip code or your state and your local, area. You can select in-person or telehealth options, and a lot of different ones will come up with their contact information. And you can shoot them an email, ask for a meeting, get to know them a little bit more. That's probably the easiest place to go as like a central hub to find a dietitian.
In your mind, I want to call this like never events, but always events. Like, what are things that when something happens or someone is diagnosed with something that you think should be an automatic, like do not pass go, do not collect $200, go straight to the nutritionist? Like, are we talking like diabetes, cardiovascular disease? Like when should we be sending people?
I love this question, Tracy, because I think always. I think always, because we can't, as primary care, we don't have the time dedicated to provide the support that that patient needs. I'm in general pediatrics for my day job, and I see on average 35 to 40 kids in an 8-hour day. In pediatrics, nutrition is top priority. It's top of mind for parents. It's top of mind for me because I'm watching their growth from infancy all the way up through adolescence. And guess what? The number one indicator of health is nutrition in pediatrics. And so I'm always talking about nutrition. But unfortunately, I have a 5 to 10 minute visit slot, right? And so for the parent who is a new mom and maybe she's seeing baby-led weaning versus traditional, what should I do? Or the baby's gagging and I'm really, really concerned. Those questions alone will take me more than 10 minutes. But I also have to address their rash, and I have to give vaccines, and I have to maybe do a referral, right? Like there's so many other things. And so for nothing else, but because we don't have the time that I believe nutrition needs to give to our patients, we can't provide them the answers and the support and the help that they truly deserve in a 10 or 15 minute visit. So I always say, always make the referral. However, you're going to have roadblocks. Unfortunately, in American medicine, nutrition is not considered important until almost like it's too late. So, for example, a patient, Medicare will not pay for a patient to be seen until they have end-stage renal disease. We will not do preventative nutrition. It's often not covered. Let me rephrase that. Often not. Same with prediabetes or obesity. It's often not covered until they have type 2 diabetes, right? And so it's very frustrating for patients because now they're going to have to come out of pocket. But it's also frustrating for dietitians because we're saying, hey, refer to me, I'll help you. But unfortunately, our system and the insurance will not cover those visits. But that being said, I always say refer the patient. Yes, if you've got a patient who has an elevated BMI or they have, central abdominal adiposity, obesity, type 2 diabetes, high blood pressure, family history of cardiovascular disease or dementia. There are fantastic dietitians out there who could give great preventative medicine and preventative nutrition support. Constipation is another one. Don't just hand out Miralax and say, take some prune juice or eat more fiber, because sometimes that does backfire, right? So I think having that approach of this is a team and maybe giving one or two helpful ideas and then saying, these are just some places that you can start. Like you can start with this, but then here's a dietitian, give them a call. They may be able to work with you for more hours, more time. They can give you some more ideas if these few things don't work for you. Because sometimes patients will just give up and say, oh, I tried to eat fiber and it didn't work for me. When maybe they only had, they only got like 15 grams of fiber when really they needed 35, right? So I would say always refer to a dietitian, but just know there may be some kickback because of insurance reimbursement and things like that. But I would, for the patient's benefit, always refer.
Are you confident you know where your next dollar should go? 403B, 457, HSA, or Roth? There are so many options. Sometimes it can feel overwhelming. A lot of providers aren't sure if their investment mix is optimized, if they're contributing enough to their investment accounts, or if they're paying too much in taxes. Meet Caleb Pepperday, a fee-only financial planner and founder of Advanced Practice Planning, LLC. Caleb helps PAs create a clear plan of action that allows them to fast-track their path to work optional living, all while keeping more of what they earn today. Caleb's process identifies the strategies that make the most sense for each PA situation and provides step-by-step guidance to put them into action. For our listeners, Caleb is offering a free one-on-one consultation where he will provide feedback on the steps you've taken in your own financial situation and if you're on track to achieve your goals. Caleb will also help you to determine if your situation warrants needing to work with a financial planner or if you're on track doing it by yourself. Head to advancedpracticeplanning.com/FI to grab your free consultation time slot. These consultations are capped each week to keep turnaround fast. That's advancedpracticeplanning.com/FI.
Advanced Practice Planning, LLC is a registered investment advisor in Montana and Pennsylvania. Advisory services are only offered to clients or prospective clients where Advanced Practice Planning, LLC and its representatives are properly registered or exempt from registration. Registration as an investment advisor is not an endorsement of the firm by securities regulators and does not mean the advisor has achieved a specific level of skill or ability. This advertisement is for informational purposes only and does not constitute individualized advice or a guarantee that you will achieve a desired result. All topics discussed in this podcast are the opinion of the podcast host and not of Advanced Practice Planning, LLC or its advisors.
Yeah. Now, let's talk a little bit along those lines about non-compliance. I think this is such a frustrating thing as clinicians, right? We're crunched for time. We're doing these notes. We're seeing umpteen patients a day, and we want them to get better. We want them to take their meds and change their lifestyle and thrive. What do we do when they're not doing what we want them to do or what we know that they need to do? Tell me about your approach to the non-compliant patient, whether that's, diet and lifestyle modifications or even medication adherence.
Okay, when you say non-compliance, my spine, the hairs on my spine just go up because I think it's a bad word. And I think we as clinicians should stop using that terminology. And here's why. Because when we label someone as non-compliant, we are taking all of the onus and all of the blame off of our shoulders and just blaming it on them that you're non-compliant, you're not doing what I'm saying. And it's kind of like you're hopeless. Like you've put a hard stop to this discussion of okay, well, what else can we do, right? They're non-compliant. That's it. End all be all. Whereas I believe a patient isn't non-compliant. They just haven't found the plan or the strategy that works for them. Remember, we are all very different. We all have very different lives outside of the 30 minutes to an hour they spend in clinic. And you often, as a provider, have no idea what's going on outside that's making this hard for the patient to stick to change, or to listen to you. The other thing that I think that you had said, which is really important and sort of a mindset shift that I discuss with clinicians all the time, is that the patient isn't doing what you want them to do. And that is often like, we are so used to being prescriptive, right? Take this antibiotic. This is your blood pressure medication. Use these eye drops. We're very comfortable with, here's the problem, here's the solution. And in medicine, that does work, but it doesn't always work for nutrition or behavior change. I can't just tell someone, okay, well, I think you should go on the Mediterranean diet. That maybe that doesn't work for them. That could be too overwhelming. They possibly don't like any of those foods that's on there. It's too broad. There isn't enough structure, right? So we have to find out, number one, what is it the patient wants to change? Because maybe as a clinician, you think that they need to lose weight, right? That's like your goal. But what's the patient's goal? Maybe their goal is to prevent cancer because their mom just got diagnosed with breast cancer and they're super concerned and want to do everything they can to prevent them from getting breast cancer. And so asking upfront, what are your goals? What would you like to see? How would you like to see your life be in 5-10 years? Maybe it is weight loss. Maybe it's coming off of their metformin. Maybe they just would like to sleep better. So finding out first and foremost what their goals are so that the two of you are aligned often prevents that feeling of oh my gosh, what's the bad word that we had talked about? Because I've taken it out of my vocabulary. Non-compliance. It removes non-compliance because now you are both aligned. And now you can give suggestions and ideas based on their goals. And another thing that I've learned from some brilliant dietitians that have taught me behavior change and throughout my studies over the years of habit change and things like that is to ask them, instead of assuming that they just are non-compliant, they're just not doing what you want them to do, ask them, hey, we've been talking about, losing weight or sticking to this diet plan for 6 months now, but it seems like this has been really challenging for you and I haven't really seen you be successful with this plan. So can I ask you, what is making this hard for you? You will be shocked. The answer will totally surprise you, I promise, every time. You probably wouldn't be able to guess what's making it hard for them, but just ask them, hey, what's making this really hard? Because now you can adjust and shift the plan, shift the strategy to fit better in their lifestyle. It could be something as simple as, well, if you put them on a meal replacement shake, maybe they're too expensive, right? Oh, I never would have guessed that those are too expensive. Let's try something else. Or, the high protein diet that you put me on really upsets my stomach and I haven't been pooping normal in the last, 3 months or whatever. Well, that's awful too. I would be non-compliant if I wasn't pooping normal, right? So asking them, why is this so hard for you? And what can we do to tweak it, to tailor it to you so that you can be successful in the future?
Yeah. I also like that question separates the problem from the patient, right? So it's not saying like, you are the problem here. It's saying, what are the hurdles that you are facing? And then you can get beside the patient and say like, okay, we can go around. This is like, we're going to solve this problem together, as opposed to them feeling like, well, why don't you, you were supposed to do this and you didn't. Like, that's not helpful. Like, shame is not it's a powerful motivator, but it doesn't breed a relationship where your patient feels like they can be honest with you or really say like, here's why, here's what's going on. Here's what's been, because there's, we see patients for such a tiny sliver, and if you saw them 6 months ago and they maybe had 2 months where they were super great and they were following the instructions, and then like their spouse was hospitalized, their dog died, all of these things, like we don't know that, right? We don't have this, all knowing, highlight reel of their life. We don't know what's going on. So unless we ask and give them an opportunity to tell us, what is standing between you and success, or why is this hard, or what is making this hard for you? then we don't really open the door for them to share what's been going on.
Yeah, I agree with you so much that it's really easy to point at the patient and say, like, you're the problem. Why aren't you doing this? And if you've ever been a patient, that feels awful. You feel attacked, you feel embarrassed often. And that's a lot of the reason why patients don't come back. We've all seen patients that haven't seen a clinician in 10 years, likely because of something that was said or some way that they felt when they were leaving the clinic the last time that was just so hurtful to them. And they didn't leave feeling empowered and motivated and feeling like, okay, I got this. And that's how I think all of our goals as clinicians should be, that the patient should leave with a plan and with a feeling of like, okay, this is totally doable. They heard me and now I know exactly what I need to do. And often it's way smaller and way less than what we want them to do, right? We would love for everybody to eat 5 fruits and vegetables and lean meat and not eat out as much and limit your alcohol intake, right? Like we want them to do all these things. But can you work with your patient and just pick one so that they can be successful consistently and then just build on that? Because I find that success and behavior change is a snowball effect. Once the patient is like, hey, you know what I did? I laced up my shoes every single day and I started to walk outside. And every day I ended up going a little bit farther. Well, what that's going to lead to is other behavior changes in other areas of their life because they can build on that success.
Yeah. Yeah. What an important reminder. And it's not linear, right? It's not like a patient woke up one day and decided they were going to lose 100 pounds and they did it between physicals, right? This is not what the internet tells us it is. It is very slow and real. And it's 2 steps forward and 1 step back and 2 more steps forward. And it's not easy, even though I feel like the science seems simple to us. Like if this, then that, right? Calories in versus calories out, like adding, walking is obviously going to drop your weight. Well, no, not necessarily, not unless we're adjusting other things and sort of understanding that like the science is straightforward, but changing the behavior to get those results is much more complicated.
And it takes time, right? Like we've got to encourage our patients to be patient because sustainable change, whether it be weight loss or another, behavioral outcome, health outcome, it takes time. You can't change your cholesterol levels in a month, that takes time. It takes consistency. And like you said, that 2 steps forward, 1 step back is fine as long as we continue to stumble forward. Like as long as we are still in forward motion. And every visit with your patient, ask them like, hi, how you doing? How is it? What areas are you struggling with? And how can I help you in that area be successful? Because at one visit, it might be they want to be more physically active. But at another, maybe they're like, I've been super stressed and I found that I'm drinking soda or sweet tea, or I'm stopping at my favorite coffee shop like multiple times a day. And their, sugar intake is out of control. We're going to work on that this time, right? Like very small bites is way more, likely to lead to success and sustainable outcomes over time. Because that's the thing, anybody can white knuckle a diet for 3 weeks, 6 weeks, if they're on a challenge and they've got a lot of motivation. But what happens when that challenge is over, right? If they've not implemented any kind of support or any kind of coping skills for stressful eating, loneliness, anger, or excitement, any reason that we reach for kind of our comfort foods, all of that success, that weight loss that they had is going to come back on with a vengeance.
Mm. And this seems to me that we do a much better job about educating patients about medications, right? So you're starting someone on an SSRI and you say, hey, this is going to take so many weeks to so many months for you to see or feel a result. I feel like we're underselling that when it comes to lifestyle. Like we're just like, you should just do it forever. And just be very patient. But we don't say, this could take weeks to months, right? Like you're going to change this thing and you're like setting that up for that. So I heard a trainer one time say education beforehand is just that. It's patient education. Explaining it afterwards is an excuse. And I was like, oh, yes. Because if we say to someone, hey, the weather's getting good. I want you to get out there and walk. And, I want you to, walk at least a mile every day and just see how you feel. And we say to them, you're not going to feel better right away. Honestly, you're probably going to feel sore and tired. And at first you're going to question why you're doing it, but just keep doing it. Do it for at least 3 months. and then I want to see you in those 3 months and we're going to talk about it and see how you're doing is completely different than you should exercise more, see you in 3 months. It's just a totally different conversation.
Totally different. I mean, even as you were talking, as you know, I have high energy. I felt a sense of calm. Like even as you were like, this is going to be hard. You're going to feel probably pretty yucky in the beginning. Like that completely calms the patient and they're walking into it now with that expectation. And if they feel great, awesome. But you set them up to know, hey, this may be pretty tricky for you. You might feel pretty yucky, especially with diets. If you're telling a patient to go on a low carbohydrate diet who has consumed 500 grams of carbohydrates in a day for the last 30 years, and now you're telling them 150 grams, you better tell them you're probably going to get headaches. You're going to crave carbs like crazy the first couple of weeks. Like set those expectations up for them so that when it happens, they can say, oh yeah, Tracy told me to expect this, but it's going to get better. And she told me what I can do to kind of get through it. And it will get better, rather than it just happening and then be like, oh my gosh, this isn't supposed to happen. This is awful. And you're totally right. Like we are great with doing that anticipatory guidance with medication, with vaccines, potential fevers or rash. We don't do that at all with any of our lifestyle changes. And I think that's a great area that we can start setting them up with what to expect. And like you had said, what the expected outcome would be. This may take you a year to lose 20 pounds, but that's okay because you'll probably keep those 20 pounds off for the next 5 years. And that's our ultimate goal.
Mm-hmm. Yeah, absolutely. So talk to me about the Obesity Medicine course. We have sort of touched on lots of these things that as clinicians, we are not giving this great comprehensive approach when we have someone with that high BMI who is starting to, tip the scales into obesity. What can we do? What does the course include? Who is it designed for? And where can we go to find out more?
Yeah, thank you. This is my passion project. We were talking off air how much work I put into this, and it's been a year in the making. And I created it alongside with my podcast. Really, my mission is just to equip clinicians with better ways to talk about nutrition, better ways to motivate your patient. And because I have seen in practice the side effects of harmful comments about a patient's body size or inappropriate diet recommendations that have gone completely awry and at the detriment of our patients. And creating the course is kind of twofold because we are seeing a huge need in the market for weight loss advice with the uptick of kind of the weight loss clinics and the GLP-1, prescribers that are popping up everywhere. And patients are not getting the support that they truly deserve in order for these outcomes to be successful. And so I was looking around and I'm like, there really is nothing out there that is all encompassing, all inclusive, comprehensive nutrition program for providers. There may be webinars, right? We've all attended them that's on GLP-1 side effects or maybe which diet is the best, but there's really nothing that walks a clinician from how do you choose a diet? How do you diagnose overweight and obesity? What are the options? Because kind of in the day and age of anti-obesity medications, we forget there's other options like bariatric surgery that is quite successful and has fantastic outcomes for patients. So kind of helping you navigate and choose the right strategy for your patient. There's nothing out there that talks about medications in depth, in detail. And if there was anything out there, it stops there. And I think, like I had said in the beginning, I think what's missing in a lot of our education, but also in our conversations with patients is that counseling approach. Is how do we handle when they have failed, right? How do we handle when they come to us and say, I was on this plan, I came off of it and they're feeling defeated. They've gained 50 pounds back. Like, where do we go from there? How do we educate? What words can we use to motivate? How do we help them create a plan? How do we have behavior change? How do we create identity-based habits with them? And so this program is 13 modules or lessons that you watch at your own pace at home in your comfy PJs. And it is not just me talking because I'm not an expert in all things. So I've brought in industry leading experts on obesity, on prescribing anti-obesity medications, on body composition analysis and going beyond BMI or scale weight, on behavior change, on motivational interviewing and intuitive eating. So there are 11 experts in this course leading the modules. And like I said, you can work through it on your own at your own pace. There's also a resource hub. I call it the resource vault that has a ton of like cheat sheets and guidelines and a few other extra modules for ongoing learning. And then I've created a community as well for like further support. You know, if you have questions or a tricky patient, I'm also sharing some, live Q&As with some of the experts to just keep that ongoing support, because sometimes, you've watched webinars. Sometimes you listen and you're like, okay, that was good. 6 months later, you kind of forgot, or you're trying to remember. Having that community and that sense of support can be really, really helpful. So it's designed for dietitians and clinicians. So MDs, NPs, and PAs, it is accredited for all of those professions. And the best part is you get 10.5 CE credits by completing the course as well.
Awesome. It does really feel like it's the roadmap that people have needed. Certainly, we are seeing these patients, they are in our offices, and we are just unequipped or ill-equipped to really have a conversation with them from a position of knowledge and compassion, and really sort of saying, I know what I'm talking about, which changes the confidence in our ability to talk to these patients. And also here are the options, laying them out in a way that's very evidence-based. They're going to feel better about having this conversation with you if you're coming from someone who's taken this course, who has confidence in their ability to sort of say, here are the options. Here's what's best now. Here's why I recommend this. And without sort of that guesswork of just like, this is what I've always done, so this is the way I'm going to keep doing it. Yeah,
I can see this would be great for clinicians who are starting to implement, weight-based treatments in their clinic, or if they're moving from, a certain specialty into treating patients with obesity, or even new grads. We are taught the information in school, but really, how do you take all of what you've learned and put it into practice and into suggestions and guidance for a patient? That can be really overwhelming and really tricky, quite frankly. And so that's the goal of this course, is that you walk away feeling very confident, not only with the facts and with the information, because it is very evidence-based, but also confident in your delivery of this information and your ability to create a plan that will work for the patient in front of you in that moment.
Yeah, absolutely. And we have an affiliate agreement with you guys. So there is a link in the show notes where you guys can go to join that course. And really, these patients are in all specialties and all settings. So take a look at your practice and think to yourself, am I serving these patients well? And if the answer is no, think about using that CME budget so that you can, learn something new and really feel confident taking care of those patients. Colleen, thanks for coming on. If people want to hear more, follow along, where are the best places they can connect with you?
Thank you, Tracy. And thanks for creating a space for me to talk about nutrition. I know it's not necessarily the goal of your podcast, but like I've said, I think nutrition should be forefront in all of our minds with our patients and honestly with ourselves as well. So thanks for letting me share my passion all about nutrition and how to have better conversations about nutrition. So if you guys want to listen to my podcast, I'm on Apple and Spotify. It's Exam Room Nutrition. You can find me on Instagram and LinkedIn at Exam Room Nutrition. And I would love if you come from Tracy's podcast, just send me a DM and let me know that you heard our conversation.
Awesome. Thanks again, Colleen.
Thank you.
I love any conversation that reminds us that it's okay to say that we don't know, that we need to look it up or get some more education or resources, and reminds us to get on the same team as our patients. Ask them what's standing in their way. Ask them about their challenges and check in to see how they are doing. Thank you, as always, for tuning into another episode of The PA is In. That's all for today. This PA is out. Congratulations. You've just joined an awesome club. By listening to a full episode of The PA is In, you are officially on the Unicorn PA team. Welcome aboard. What most team members do is they subscribe to the podcast because that allows them to automatically get the latest episode of the show. The life of your dreams exists on the other side of taking action. Keep making small shifts and keep getting better. Your life will improve, your career will soar, and you will have the confidence you need to create your own success. I will see you in the next episode. This PA is out.